Specialist working as Associate Director, Department of Obs, Gynae and Fertility at Cloudnine Hospital, Chandigarh. I'm here to talk about infertility today. See, over the years I have realized that fertility is as much a social problem as it is a medical problem. Over the years, when a couple is married for many years or even for lesser years, everybody starts asking them. So the relatives and the friends, they kind of poke into your lives and ask you as to why you're not having a baby yet. So the couples who come to us are very anxious. So my mantra is to handle the emotions and the medical problems simultaneously. So we should actually be encouraging our couples to open up and try to allay their anxiety as much as, on the other hand, treat them. So the treatment modalities for infertility depend upon the diagnosis. So when we first approach a couple, after taking a good history, listening to them well, we write them a few investigations, and after doing those investigations, we reach a conclusion as to, or a diagnosis. We reach a diagnosis, and then we guide them as to how to proceed to make them conceive. And not everybody needs an IVF. So what happens is most of the couples would conceive naturally with a little guidance, maybe some with a few ovulation induction drugs. Sometimes you would need a corrective surgery. Sometimes you would need a procedure called intrauterine insemination or IUI, wherein we concentrate the gametes so that the probability of conceiving increases. And then there is a small percentage which needs an IVF. IVF, in vitro fertilization, also called test tube baby. So who needs IVF? Basically, the direct indications for IVF is when a lady has both her tubes blocked. So that's called tubal factor infertility. Sometimes a male has either very few sperms, or sometimes what happens is that the sperms are inside the body but they're not being ejaculated. So those couples need IVF. And then subgroup called unexplained infertility, which I always tell my patients is the most frustrating for a couple, because over the years you've been to many doctors, you've gone through many tests, and they've always concluded that कोई problem तो नहीं है, but फिर भी conceive नहीं हो रहा. That is unexplained infertility, wherein there is no gross problem, but there could be some defects in fertilization process, which is in itself a very intricate process. So in that cases you need an IVF. And let me just explain what IVF is. See, IVF is wherein we stimulate a woman starting from second day of her periods. We give her some injections to form multiple eggs, and then we follow via ultrasounds, we follow the growth of the eggs, and then when the eggs are good enough, they are fertilizable, then we just take them outside the body via a transvaginal scan under anesthesia, so that the woman has no pain or no memory of the procedure. It is a 10-15 minutes procedure, and that's how we obtain the eggs. On the same day, the husband is asked to give away his semen sample to us in the lab. Embryos are then made in the lab, and they are very gently, delicately put inside the womb of the woman, and the whole process takes about 2 to 2.5 weeks. And in the next 2 weeks you wait for the result. So IVF happens in over a month, with maybe about 5 to 6 visits to a fertility clinic. So and there are so many myths about IVF, that it is very painful, or it should not be done, it should be put behind for a later date. But what I request and suggest is that every fertility treatment very heavily depends upon the age of the woman and the duration of marriage. Longer is the duration of marriage and greater is the age of the woman, even IVF will not give any miracles. So if you have been diagnosed with any of the direct or indirect problems leading to IVF, you should not delay the treatment, and you should get it at the earliest for best results. And for any queries, you can contact me at Cloudnine Hospital, Chandigarh. Thank you so much.